Hey, my name is Melanie Scruggs, and today I will present to you a PowerPoint presentation on important facts about personal protective equipment, also known as PPE. And after the presentation, I will provide you with a video that gives you the proper use of personal protective equipment. So let's get started. Okay, guys, we're going to go ahead and get started with our presentation. As I stated, we're going to be talking about personal protective equipment. As you can see, my name is Melanie Scruggs. The class is ACD 4550, which is Health and Safety in the Workplace. The instructor is Dr. Diane Wright, and today is April the 11th, 2013. All right, and today I'm just going to really give you a definition at first, and it's basically personal protective equipment is designed to protect workers from serious workplace injuries or illnesses resulting from contact with chemical, radiological, physical, electrical, and many other hazards. It basically creates barriers between the hazards and the routes of entry. It must be worn to provide protection, but it doesn't completely eliminate you from that hazard. It just helps to reduce exposure to the hazards. Okay, and with the OSHA personal protective equipment standard, the code that it complies with is 29 CFR 1910.139 for general requirements. And there are also other related codes that will be given throughout this presentation on things like eye protection and foot protection, etc. All right, and first, with most employers, they provide with their employees a hazard assessment, which is like the first critical step in identifying physical and health hazards in the workplace. And they begin that with a walkthrough survey that helps to develop a potential list of hazards in areas such as impacts, chemicals, heat and cold, and also like harmful dust or and anything like that. And employees, once they get finished with the training and everything, after they do the hazard assessment, they begin the training. Once they finish with the training, the employees are trained to know when personal protective equipment is necessary, what personal protective equipment is necessary, and how to properly put on, take off, adjust, and wear the personal protective equipment. All right, so first we're going to start. This is just telling you some routes of exposure. Like the picture, you see inhalation, skin absorption, ingestion, and injection. And also, just to get like a little key thing, knowing the hazards and how to protect yourself is the key to your safety. And this is the types of personal protective equipment that we have. We have eye protection, we have respiratory protection, foot protection, hand and skin protection. There are also other protections that they have, but we're only going to talk about these four in our presentation. There are other ones like face protection, head protection, electrical protection, and a couple of others like hearing protection. With eye protection, basically the employees are required to have appropriate eye or face protection if they're exposed to flying particles, liquid chemicals, acids, and anything other like that. Some of the risks with the eye protection, if they don't have, they can have dust, dirt, or wood chips entering their eyes or chemical splashes. Some examples of some eye protection are goggles. This complies with the OSHA 29 CFR 1910.133, and those are some examples of some goggles that they have. And I also have some hands-on goggles that you can see in class. All right, with the respiratory protection, basically it's required when the employees are in areas where effective control are not capable to protect the health of employees from harmful dust, fogs, fumes, smokes. A risk can be lung damage because, like with respiratory protection, one route is inhalation, which can damage the lungs, and this is basically the most direct route to your bloodstream. So, masks are an example of some respiratory protection, and I also have an example of that you can see in class as well. And basically, it just covers your nose and your mouth so you won't inhale it any kind of way. All right, you have foot protection. It requires employees to use where danger of foot injuries due to falling and rolling objects, slips, and electrical hazards. You also have risk of like impact, slips, compression, shock, slipping, here, heat as well. So, excuse me, I made a little mess up right there. And they also would like for foot protection, they want you to wear like slip resistant soles, and basically assure that you have proper fit of shoes and shoe covers. I have also a demonstration of those shoe covers as well. This complies with the OSHA 29 CFR 1910 136. All right, and this is hand and skin. It's required in areas where your hands and body are exposed to skin absorption of harmful substances or severe cuts. You can get in contact with toxic chemicals, biological substances, and that's why they have gloves for hand and skin protection of personal protection or the personal equipment. Pretty much, you have, it basically depends upon the type of hazard you have. Personal hygiene is one thing. Make sure you just wash your hands, and that's a good thing that they have as well with the hand and skin protection. And this complies with the OSHA 29 CFR 1910 138. And these are examples of some gloves, and I have some of those as well. And this is just the video that I will present to you, and it's just going to get a little bit of this video. So.
Personal protective equipment should be selected based upon proximity to the patient and the likelihood of contact with any blood or body fluids during procedures in the patient care area. This video will demonstrate the proper sequence for donning and doffing personal protective equipment from the Centers for Disease Control. The first step in donning personal protective equipment is good hand hygiene. The second step of the procedure is donning the gown. The gown should be fastened at the back of the neck and the waist by tying a bow. The third step is the selection of respiratory protection. One option might be a procedure mask. Procedure masks are used for droplet precautions. Droplet precautions are used in the care of patients with influenza. To apply this mask, gently crease the metal insert to create an indentation for your nose. Then cuff the elastic bands around your ears and spread the mask to cover your face from the bridge of your nose to below the chin. Finally, ensure the mask is snug and comfortable on your face. If the respiratory protection you selected does not have attached eye protection, eyewear should be selected next. Protective eyewear might be safety glasses or goggles. Many shapes and styles are available. The final step in the procedure is the application of gloves. Ensure that the cuff of each glove covers the wrist of the isolation gown. A secure fit will prevent gapping while providing care to the patient. Before entering the room, ensure all personal protective equipment is in place and comfortable. This will prevent you from adjusting your personal protective equipment while in the patient care area and potentially contaminating unprotected areas of your body. You are now ready to provide care to your patient.
I thank you, and I hope that you enjoy my personal protection equipment, also known as PPE PowerPoint presentation. And I also have some hands-on things that you can use. There are some gloves, goggles, the bodysuit, and some footwear. And so we're going to see these in class. Thanks.